Warning. Listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
And welcome back to another episode of Influencers Radio. You know, as parents, we want the best for our kids. And when it comes to pain and discomfort, we do just about anything to take that pain and discomfort away. Well, you know, I recently read a very surprising statistic, and that's that at least 1 in 10 children have the skin condition eczema. Now, this diagnosis can be incredibly overwhelming, confusing, and frustrating for parents, especially when they don't know why their child has this condition and how they can help heal their child's skin. Now, my guest today is Dr. Maria Sylma Tweed. She is a pediatrician and the founder of Dr. Sylma, an organic skincare line for babies and children with eczema and sensitive skin. As a board-certified pediatrician with over 20 years of pediatric experience, Dr. Sylma educates, guides, and supports families during their difficult journey, helping them not only to understand the root causes of their child's eczema, but to also provide them with the right solutions so they can do their very best to help their children have happy and healthy skin. Dr. Sylma, welcome to Influencers Radio.
Oh, thank you, Jack. I'm so happy and honored to be here.
Well, I'm glad to have you here because, you know, you're someone that, really has a passion around this topic. And I think everybody has a soft spot in their heart when it comes to children, especially children, they're suffering from something like this. And, with eczema, it goes far beyond just discomfort and itching. There's also some mental impacts to this that I'm going to want to get into. But first, I have to admit that I was pretty shocked when I read that at least 1 in 10 children have eczema. So I'd like to kick this off by asking you if you can explain exactly what eczema is and why it's so common.
Yeah, so you're right. 1 out of 10 children, which means about 9.6 million children in the United States suffer from eczema. And it is a chronic skin condition that usually presents with rashes and dry skin, redness, and especially itching. Across the board, if you look at all children with eczema, the whole spectrum, including adults, the number one complaint is just itching. So it is an uncomfortable skin condition. And in kids, imagine, just like you said, it's just to see your child uncomfortable, having painful, itchy skin. It just, as a parent, it just breaks your heart. Interestingly, 60% of all eczema cases appear during the first year of life. And out of that 60%, almost half of those cases, eczema develops between 2 to 6 months of age. So little babies. So that's when parents, especially new parents, right, they just see that their child starts having some rashes, and then they feel like maybe they're doing something wrong, right, that the child is, having problems with rashes and discomfort. And that's when, as a pediatrician, right, they come for the well checkups. And that's when the whole journey starts in terms of identifying whether indeed it's eczema or not. And how can we start there, in their journey to heal the skin? And because it is a chronic condition, there's no cure. Some kids outgrow it, but others have it until they're adults. And again, you can have times where your skin can look okay, pretty good, but then there are other times where you have flare-ups. And those are the times that are tough, not only for the child, but also for the families. I mean, it affects the whole family unit for sure.
Well, yeah, and I know, and I've I've known people that have children with eczema, and it's almost regardless of what anyone says, they can't help but feel some guilt that there's something that maybe they could have done, or that something that they did wrong, or did they feed them something wrong, or anything like that. Mm-hmm. Can you kind of dispel some of those misconceptions, maybe, and really go into, and if it's even known, what triggers eczema, what causes this in babies and children?
Yes, I mean, when I first see them at the office, right, at the clinic, and they come in, and again, the rash looks very suspicious, and that it is eczema. Then that's the first question. That's the number one question across the board that all parents ask. Why does my child have eczema? And the second one is, did I do something wrong? So that's when we have to tell the parents, please, no, it's not your fault, and really tell them that it's no reason for them to feel guilty. Eczema. It is a very complex skin condition, and there are different factors that contribute to the diagnosis. And unfortunately, there's no the cause is unknown. Like, we don't know that we cannot pinpoint, oh my goodness, this is exactly what's causing your child eczema. And what triggers one child might be different to another child. But what we know is that it is a combination of factors, that genetics, genes, our family history, family medical history is a major contributor, and also the environment. Environmental factors or triggers, that's also a major one. And that's the one that we can sort of control. But when it comes to the family history, it is what it is, right? But still, you can still give hope to the parents that there's still a possibility that a child cannot outgrow it, and that it's just a matter of identifying those triggers and to tweak things so that those flare-ups are few and far between.
What I'd like to talk about, and I definitely want to get into some of these solutions of what people can do, and I know a lot of people want to get to that, but I really want to make sure that it's not missed. Some of the issues that come along with eczema. A lot of people think of it as a skin condition, and like you said, it flares up sometimes it doesn't. Skin itches, but it impacts people's lives far deeper than that. In both. One, some of the things that you talk about that really made me think deeply about this is how sleep is affected with eczema. But not just with the child that has it, but with the parents that are dealing with that. And also, I'd like to get into the other aspects that eczema can have, the impact it can have on people's lives, and the things that both the kids and parents could deal with.
Yeah, so you're completely right. So not only does it affect the child, but also the parents. Because then, as a mom, when you see your child suffering, then of course you're going to suffer, right? So so sleep is a major thing. About 30% of children with eczema experience disrupted sleep 5 or more nights a week. And that definitely leads to daytime sleepiness, irritability, inattention, and moodiness. And you can see how that can affect the school experience, right? The night before, the child can't sleep. Then the next day, the school, the day at school is just not going to be the best. So when your child doesn't sleep, then as a parent, you don't sleep either, right? So because it is a chronic condition, the child can be sleep deprived, the same with the parents. And it's something that a lot of people really don't think about unless you are the one that's living it, right? But unfortunately, then parents that are sleep deprived for years, because this can occur for years, they can even experience depression, anxiety, and guilt. So again, that's how, like we mentioned previously, how this chronic medical or skin condition not only can affect the physical aspect, right, the skin, what you can see, the visible part of it, but also it can start affecting not only the child's mental well-being, but also the parents.
Yeah, then that's something that I think a lot of people don't think of. It's more than just a skin flare-up and discomfort with itchiness. And so you talked about that, that relationship between eczema and depression, because you say it's a chronic. There's no telling that it may go away, but it's really something that isn't cured. How do you see this affecting children's self-esteem and confidence, especially when they get to those preteen, teen years?
Yeah. So when it comes to like anxiety and depression, and now because of the pandemic, COVID pandemic, we're talking more about mental health, right, and mental well-being, which I think is one of the only positive things that have come out of the pandemic, is just to have that understanding of how important our mental well-being is. And it has opened the door to really have the conversations, not only with our children, our teenagers, but also among adults. And definitely there is a relationship between eczema and anxiety and depression in children and teens. There was a study that was done just last year, 2021, in the Journal of Pediatric Dermatology, and it showed that kids with eczema are 2 to 6 times more likely to have depression and anxiety than children that don't have eczema. I mean, that's huge. 2 to 6 times more likely. When you see a child that has a chronic medical condition, a chronic illness, then again, not only the physical part, but also the mental part. And you wouldn't think that just eczema would be considered as a condition that might also, have that impact in the mental health. But, definitely it is. And the reason is because, eczema, you can see it. When the child has patches of irritated skin that sometimes those patches don't look pretty. I mean, they can be thickened. They can sometimes be even oozing if they're not covered. Then imagine when that child goes to school, that child is just going to be ostracized, right? The kids are not going to want to be around that child. First, because they think, oh, no, I don't want what he or she has on the skin. I might get it, right? And number two, unfortunately, kids can be cruel. So bullying is just a major factor. So, the child can be ridiculed. Other kids might make jokes about the child. They won't play with the child. So imagine the experience at school every single day and how that can affect the mental health of a child. So not only will it affect the way that they can concentrate right in school to succeed academically, but those social interactions that these past 2 years we have all noticed how important they are, right? We are social animals, right? And then in childhood, those social skills is when you develop them. Imagine if you don't have that social interaction with others, it definitely will affect the mental well-being, and it can lead to anxiety and depression in kids.
Yeah, and I can imagine, just to really put a spotlight on that, it's things that we just take for granted that kids doing when they're kids, part of childhood, that great thing, the going to swim parties, the PE and gym and school, slumber parties, that kind of thing. All those, all of a sudden, it changes. I guess it can create withdrawal, right, from kids that, nope, don't want to go to that because I won't be able to cover my arms or something like that. Is that what you're talking about?
No, absolutely. Yeah, it's just the fear of what others are going to think, So, yeah, you mentioned all the big ones, right? Play dates, sleepovers, even taking PE at school or sports after school. There are different things that can trigger an eczema flare-up. For example, school activities like sports, they start sweating. Sweating is a trigger. Maybe the uniform that they use at school is made of a fabric that irritates the skin, and that might be another trigger. Even like something that you wouldn't even think of, like art class, paint and glue that they might use, those chemicals that might irritate the skin, that might also be a trigger. So you can see all the ramifications of how anxious then the child would be, knowing that any little thing might end up causing a trigger and preventing them from participating in what they would love to do. That's why, communication with the teachers is so important, and trying to control the environment as much as you can. But, you just cannot control everything. So, again, that communication with the teachers and the school staff is just extremely important.
Well, the one thing that I really appreciate about what you're doing, and I think the real difference maker that you're doing, especially as a doctor, unfortunately, one of the big frustrations that it seems like parents have around this is when they get the diagnosis, and I know it's the old cliche, doctors, well, there's a pill for that. Right. And a lot of times they don't get much more than that diagnosis, and there's a pill for that. And the one thing that you are just remarkable at, and I think that the people that have had the good fortune to be able to find you, to help them with this, is the support that you provide beyond the actual, physical treatment, but the fact that you're supporting them in that overwhelm, in that mental impact, and helping them to understand what's going on. So I'd like to get into that. Beyond the diagnosis, and here's your child has eczema. Here's a prescription. Try that. Can you go into some of those, the things that people can do in order to live with it? Because like you said, again, there's not really a cure, but for people that live with this, what are some of those, some of the things that people can do to alleviate this or minimize some of the impact?
Yeah, I mean, as a physician, I went into medicine because I want to help people, right? But unfortunately, the reality of medicine nowadays is the limits in time, the time constraints when it comes to the length of time that you can spend with the patient. So imagine when you only have 15 minutes to see the child, talk to the parents, examine the patient, give recommendations and treatments, write prescriptions, document the chart, and you have to do all that in 15 minutes, and hopefully you'll have time to kind of guide the parents, right, in regarding whatever illness the child has. So yes, it is frustrating for parents, but it is frustrating for physicians too. And I've always done the best that I can to really spend the time, even if that meant sacrificing the time for charting, and then if I had to do that after work. Because for me, that trust and that doctor-patient relationship is extremely important. And so then I felt I've always been passionate about eczema. I see parents coming in and their frustration, and that's when I felt like, number one, I could create a skincare product of better quality with non-toxic ingredients that parents can trust. But most importantly, just having the time, just like you said, beyond the four walls of my clinical practice, to really give the support and education for the parents. I can remember one time I was covering for another doctor at a different clinic, and all of his patients were their new patients to me, right? And I saw this boy, he was about 5 or 6, and I went into the room, and I immediately knew that it was eczema. I mean, his skin was just thickened. It looked so painful. It was oozing. And then the mom was just like in tears. She was in tears. I mean, she just didn't know what else to do. And so I mean, I still get a little emotional thinking about it because, as a mom, it's just hard to see, the child suffering.
I can, I know that it's that helpless feeling. There's nothing more helpless in the world than to see your child suffering and not knowing what to do and not being able to fix it. That's all you want to do is to fix it. Thankfully, I was able to provide her with, other treatments and direct her to be seen with a specialist. So, it had sort of a happy ending. I mean, I could give her hope, right? Because that's a lot of parents, that's all they're looking for, just hope that the skin condition will get better. So again, it's just, for me, that support and guidance and just the time that I can give them to educate them and answer all the questions that they have for me, it's priceless. So that's why I created this, Dr. Sylma, and I hope, I'll be able to reach many families and to offer the help that they need. Well, that's what I want to kind of dive into next, because you talked about the limits of those 4 walls of the clinic, and I have to commend you for your relentless pursuit of breaking through those walls and reaching, far-reaching, the parents that really need, those parents that feel just like that mother you described, that helpless. I just, want to figure out a way to fix this. So I'd like to talk about what you've done. I guess starting off with the skincare products that you've developed, because you've developed an award-winning line of products for this, and a lot of people think about with skincare, well, there's over-the-counter stuff that you can get at the store, but to me, what you've created, it's like the difference between buying a No More Tears shampoo, off the shelf versus something that truly can have a life-changing impact on somebody that's dealing with this. So, if you wouldn't mind, can you kind of talk about a little bit about that product line you have and why the people that are discovering this or having the success and raving so much about what their what the results are?
Yeah. Well, thank you. Thank you for asking. I'm in the process of creating a complete line of skincare products. Right now I have a flagship product. It's called Lovingly Soothing Balm. And I'm proud to say that it won Best Baby Balm at the Beauty Shortlist Baby and Mama Awards. And these awards are from the UK. And we won last year, 2020 and 2021. Excuse me. So I'm very proud to say that it is, of course, a high quality product. And most importantly, that it's something that works, that has wholesome, non-toxic ingredients that are plant-based. And, in my clinical practice, when I was in residency, I was taught what to recommend, and I did that for years. And that doesn't mean that those products don't work, but when I looked at the ingredients, I'm like, oh, there are just a lot of petrochemicals and ingredients that can affect the hormones in children, and I was just like appalled. And then, just seeing patients and treating them, then I knew what kind of works and doesn't, although each child is different. And that's what's overwhelming for some parents, just trying to find the right product for their child. But I decided then to, just to create something that is non-toxic and wholesome that truly works, and give a variety of products that will give parents the choice to figure out or find out or to see which ones work. Because like I said, it all depends on the time of the year, whether you need a thicker oil-based balm or ointment when the temperature is cold and dry, versus when it's in the middle of the summer, you just might need something lighter. So again, I'm just very happy to be able to provide that for the families. And like I said, I just have one product now, but creating more that will come, will be launched later this year. So I'm very happy about that.
Well, and I think there's a lot of parents that are very happy about that too. And, I think it's important that that I bring up the fact that, you're not someone that thought, oh, it'd be cool to have a line of products, right? You have been invested. You have had, unwavering commitment to this problem, to this condition. I know you've done volunteer work, providing care to children, indigent and migrant families. You've organized and led mission trips to Panama, I believe. Can you talk about a little bit about that, and did that kind of fuel your passion to lead you where you are today? What really did fuel that passion to do what you do and help the people that you're helping?
Well, thank you. It's a long story. I'll try to make it short, but I just took after. We had our second child, I wanted to spend more time with my children. And as a pediatrician, you're just so busy between clinic, you have to go to the hospital, call, and everything that comes with that. And it came to a point where I took a break, Jack. I mean, I left medicine for 7 years to stay with my children. I became a stay-at-home mom, and I loved it. I could volunteer. I could go to their school, and then that opened my heart and the possibilities of my talents, of bringing my talents and helping people in different ways without the limitation of having a job or getting paid for seeing someone. Right? To see someone for free, for me, it's freedom. It's total freedom. Because then I can really spend the time and not only treat the child, but also, again, the whole family unit, and have that trusting relationship like I mentioned before. So through my church, yes, I was able to organize several mission trips to the Republic of Panama in Central America. That's where my husband is from. So we went to remote villages up in the mountains, no electricity, and then we saw children there. And then I've always had a passion ever since I was before medical school. I grew up, I lived a few years in Mexico. So we were, with my parents, we volunteered through church, and we were always going to orphanages and things like that. So they planted that seed in my heart. And so I've always loved working with underserved population. In medical school, I had an opportunity to work with migrant families here in Ruskin, in Florida area, and I loved it. So when I was being a stay-at-home mom for those 7 years, I didn't want to get rusty. I wanted to continue practicing in some way, and then I found this clinic in Clearwater, Florida, and then I was there once, every week, at least once a week, for about 7 years, and having the gift of seeing these families and treating these children, which most of them only speak Spanish. I'm Hispanic, so again, just having an opportunity to serve people with the gift and parents that I have.
Well, I'll tell you, you've done a remarkable job, and just like I said, going beyond those four walls of a clinic and really giving a reach to a solution and support that a lot of families just can't find. And again, one of the things I love about what you're doing is you have the product, but you go beyond here. Rub this on, right? That you actually provide the support on living with this. So can you? And I know it's a deep topic, but are there some suggestions that you have just initially on how someone can build a skincare routine? Because when you live with this, it's something that you have to pay attention. I'm sure it's something you have to keep up with. What type of skincare routine do you recommend, especially when children are so hard to keep up with this stuff on themselves? Is there some tips and tricks around that you can provide to?
Yeah, absolutely. Yeah. So it is so important to know the basics of how to take care of your child's eczema skin. And again, always surprised by how many parents really don't have that knowledge of no fault of their own. It's because no one has sat down with them to explain how to do it. And going online on the internet, many times it's just very confusing, because then you don't know who to trust or who to listen to, right? But again, the basics, just very simple. Bathing, when you bathe your child, you have to think about the water temperature. It should not be hot water. It should be either cool or lukewarm, because, again, the hot water just strips away the baby's, the natural oils of the baby's skin, and then it will dry it out, and obviously making the eczema symptoms worse. So, again, temperature of the water, either cool, but most likely, lukewarm, never hot. And also the length of bath time, it should be no more than 10 minutes. Again, for the same reason. You spend too much time in the water, believe it or not. When you come out, it strips away the oils from the skin. Second, the cleanser. Excuse me. What you use to cleanse the skin is very important. Bar soaps are very, very harsh. Body washes and bubble baths, I just dislike them. Even in kids without eczema, it's just something that I don't recommend. But especially in kids with eczema, it's just extremely harsh and very drying and irritating for the skin. So if you can find a cleanser that is geared towards, that is eczema friendly and geared towards sensitive skin, would be best. And then third, a moisturizer. It is so incredibly important. The skin in eczema loses a lot of water, and moisturizing it is just extremely important to really prevent flare-ups and to treat flare-ups as best as you can when they occur. I do recommend balms and ointments because they're oil-based, and then they really prevent that water loss from the skin. And thick creams are also a good option as well. The thicker, the better.
Well, you're so generous in your education and the things that you do to help people. Like I said, beyond your product that you've been developing. And like I said before, you really do have this relentless, unwavering commitment to be able to help as many people as possible beyond, who can walk into a clinic. I have to ask, how can people, find out more? How can people get involved? How can people benefit from Dr. Sylma, who, may not be in your geographic area or within your reach? What can they do?
Yeah, so I do have a Facebook group. It's called Dr. Sylma Eczema Mamas. So I do invite all the mamas out there with babies and children that suffer from eczema to really join our community. It is truly a loving space to learn and to feel empowered and supported. as these moms navigate through their children's eczema journey. I'm usually there along with other parents, just to chat and connect. It's also a great space to really share stories and support each other. I always come in with, skincare tips, eczema tips. I do live videos, and I do answer any questions that, parents, moms have as best as I can. So I do provide them with that education, guidance, and support that a lot of these moms are really, really looking for. And again, the Facebook group is Dr. Sylma Eczema Mamas, and I can't wait to connect with moms there. Thank you.
Oh, well, thank you. It really is. You've made a difference to a lot of lives, and I'm sure you're looking forward to making difference to a lot more lives. So I want to thank you so much for coming on today and sharing this this information. You truly are an influencer, and it's just so much more than going to a doctor, getting a diagnosis, and here, take this. You help these families, not just in the physical condition, but all the mental impacts that this has. So again, thank you so much for coming on and sharing this.
No, thank you for the opportunity. I really appreciate it.
All right, folks, there you have it. Definitely check out Dr. Sylma if you are in this position and you have a child or with eczema or sensitive skin in general. I encourage you to take advantage of this and get in there and support with other people that understand and know what you're going through and can give you that support. We'll definitely have a link right there on the show post, and also how you can find out more about Dr. Sylma's products and some of the education that she provides. Until next time on Influencers Radio, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today.